Okay, this patient is going to do breast augmentation today. She previously had breast augmentation with silicone implants. There were some complications. They were removed. So we have a little bit more of a challenge today. We have this very high riding incision. We're going to do 385 cc full profile implants Natrel. The base width is 12.25 and the C+2 distance is 9.9. And you know, when you put the nipple on stretch, this is much shorter than 9.9. So we'll have to find a way to lower this incision because I don't want to make a second incision. We'll have to release this scar and stretch it down in order to bring it to where the new inframemory fold is going to be. So let me show you how I do my markings. First, I identify the midline. And then I mark the footprint of each breast. And you can see her footprint. Now let's talk about the different aspects of planning for breast surgery. So the chest wall looks pretty symmetric. The breast footprint is wider than it is tall, which is normal. It's riding pretty high, so if you look at the axillary fold, the top of the upper breast border is almost at the same level. So we know when we add the implant, that's going to expand. The implant is going to sit high on her chest. There's nothing we can really do about that because we want the implant to be centered over the nipple and the areola. Okay, I have the footprints marked on each side. Now I'm going to mark the inferior inframemory fold height and then the upper breast border height, and that's going to give us the breast footprint height. So the next step is to find the meridian. So I have the nipple position here, the meridian is there, and I measure this distance. So we're about 10 centimeters. So I'll go that same distance, and yes, it lines up with the areola here. I use the intermammary distance of one for just a regular augmentation, 1 centimeter on each side, so 2 centimeters. And now we know the implant, we need 9.9 centimeters here based on the C+2. So I somehow need to lower this incision down to right here by releasing and pulling it down. So we know the new inferior border of the breast, once the implant is placed, is going to expand down to here, more or less. And we need a breast height of 12.25. So we know the new breast height is going to be here. And the midpoint is going to be at 6.125, which is here. And then the implant is going to come down to right here. So we're going to lower the fold like this. And then 12.25 right here. So that's going to be the contour of the implant. So the implant's going to sit here. It's going to pull that breast tissue towards the front, pull the nipple towards the middle. So yes, even though the meridian of the breast is here and the midpoint of the implant is here, it all gets pulled towards the middle, and the breast goes from being more oval to being more round. And again, the challenge here is going to keep the nipple centered over the implant, and the way I do that is I need to find a way to lower this incision and lower this fold.